Greetings to you from the Federation for Children with Special Needs. We hope that you and your family are safe and well during this challenging time. I'm Ruth Diaz, the Director of Parent Training and Information Center for Massachusetts, part of the Federation. Like many of you, we have been working remotely since Tuesday, and all of the challenges of working so quickly, moving so quickly to remote work. Today is our Fact Friday live stream, and I wanted to talk to you about the guidance that we received from the U.S. Department of Education and the Massachusetts Department of Elementary and Secondary Education, DOE. As you know, Governor Baker declared, a temporary closing of all schools, public and private, not the residential, not the schools for children with special needs, specialized schools, but all of the other public and private schools were closed until April 6th. So this was a unprecedented move, but very necessary in order to stop the spread of the COVID-19 virus. We've heard from many families and advocates like you who are concerned about the school closing and how it's going to affect children's education, their services, and their progress. And so both the U.S. Department of Education and DOE have attempted to respond in some way. The U.S. Department of Education acknowledged that these are unprecedented times. These are times in which the law did not anticipate ever having to close for a pandemic. So the guidance is, you really can't look to the law for a clear direction. But the guidance from the U.S. Department of Education is that if schools do not provide services for general education students, they do not have to provide services for special education students either. If, however, the schools do provide services to general education students, then they also must provide services to special education students in order to give them equal opportunity and access. Once the schools reopen, the schools must make every effort to provide the special education services and the related services in accordance with the student's IEP and 504 plans. If the schools do not provide those services once the schools reopen, then there could be a claim in that situation for compensatory services. So it appears that there is no claim if the schools do not provide services to anyone, and no claim for the same services, but if the school, once they reopen, they can be required to provide compensatory services for failing to provide services once the school is back in session. The guidance further states that schools should ensure to the greatest extent possible that each student is receiving special education and related services that is listed in their IEP and 504 plan. So they're, encouraging that they're requiring it to, to the extent that they're saying the greatest extent possible. But there's always the possibility that the schools, for some reason or another, cannot do it. If the district determines that each student would benefit from either online or virtual instruction, instructional phone calls, or other types of learning instructional activity, then they are strongly encouraged to do that, to provide it. Now, DESE had a little bit of guidance as well, in addition to what the federal government said. Um, they said, DESE said that the school districts should reach out to students, parents, and guardians by phone, by email, or whatever other means during this closed period of time to gain an understanding of how the school closure is impacting the students' access to education um, and progress. And that staff should be planning how to best provide equitable services, alternative services um, to educational resources such as lists of books, book reading lists, internet-based lessons, work packets, other available learning approaches. And that after the extended closure, schools should be reviewing the impact on each student of the delivery or failure to deliver special education related services. So they would convene independent, I'm sorry, individual IEP team meetings and decide what services, additional services, need to be provided in order to bring the student, you know, up to functioning prior to the school closure. And that the team should consider things like the students' academic progress towards their IEP goals, the nature of the services that were missed, the frequency of the services that were missed, reports from providers, and the previous educational history and any history or concerns about substantial regression. As parents, we should be thinking about how do we explain later on the impact on the child of having lost services. It's easy to forget. So I would certainly, if it was me, I would be keeping a log or a chronology to help me later on remember how this closure affected the child and what sort of things the child needs in order to get back online with learning. These are difficult times. We're all doing our best to adapt to fast changing circumstances. And I think the teachers and the schools are in the same boat. I know that for the Federation, it was quite an adjustment this week, working from home. From one day to the next, the decision was made. And, but we have risen to the occasion. And I'm sure that the schools are likewise working hard to rise to the occasion. And we're trying to, in this process, figure out how we can best be of service to you. So in the meantime, I want you to know that we are open for questions as usual. We have staff and people helping us answer calls and questions. So if you have concerns, you can contact us through our online intake form. That would be the best way, even though we do still have phone service available. You can reach our online form at www.fcsn.org. And there's a big button there, a big square where you can just click and it'll bring you right to the intake form. And we can have someone call you back almost the same day, I think, at this point. We can call you right back. So thank you for your kind attention, and be safe, and take care of yourself and your family. Good night.